and food safety, and foreign policy's Andrew Stollinger for a conversation on universal HPV vaccination strategies.
Hello, everyone. Have you had refreshments and a break? Healthy snacks only, some protein, and we're back to chat with two great guests, Minister Akko Ankarberg Johansson, Minister for Healthcare of Sweden, and Stella Kyriakides, European Commissioner for Health and Food Safety. We're going to talk about cervical cancer, a disease caused by HPV, human papillomavirus. It's the fourth most common form of cancer among women worldwide. One thing that we have learned over time is that women vaccinated before age 14 have 0 cases of cervical cancer. This is something we can fix. So we're going to talk about how we fix that. A 90% vaccination rate among girls by the age of 15 and a 70% screening rate and a 90% treatment rate for precancerous lesions is a path that the WHO Cervical Cancer Elimination Initiative has laid out for us. But most of these deaths that occur happen in low-income countries and middle-income countries. So we want to talk about what kind of strategies we can use to improve upon that. And Sweden has been one of several European countries to enact this. Actually, has pioneered a gender-neutral vaccination strategy and is on its way to becoming one of the first countries in the world to achieve cervical cancer elimination. Kudos. And meanwhile, very good. And meanwhile, the EC ratified the Europe Beating Cancer Plan, which supports member states' efforts to strengthen routine vaccination against HPV for both girls and boys by 2030. And it causes other cancers, by the way, HPV, not just cervical cancer. And both of these cases demonstrate a commitment to implementation. We want to pull that apart and find out what we can learn from both Akko and Stella. So thank you for joining us. Akko, within the next 4 years, Sweden is expected to be the first country to eliminate cervical cancer thanks to ongoing efforts to improve vaccination and screening. Congratulations. Tell us a little bit about how that's happened.
Oh, it is important for us to save lives because that is our motivation. And through working with both prevention and early detection, vaccines and screening, we could do that. Of course, we started with the girls, as you mentioned. 2010, we started with every schoolgirl in year 5. We offered cost-free, population-based vaccinations for them. And 2020, we know so much about the evidence that if we also offer these vaccines to boys in same year in school, we could eliminate cancer at women, but also other kind of HPV-related cancers. And that was a win-win situation. So we started this gender-neutral vaccinations, and we have gone further today, but maybe we stop there, because if we work with both boys and girls, we could both eliminate cervical cancer, and that's fantastic, and we could also lessen the burden of HPV-related cancers, and there are many. So it's a good thing to do.
What are the HPV-related cancers? Maybe you could educate us on that besides
you are
cervical
the physician.
cancer.
There are other HPV-related cancers which have to do with neck and head cancers and anal cancers, but I just want to pick up on, if I may, on what Akko said and what you said at the very beginning, that cervical cancer is one of the most common forms of cancer that we see in women, but it is also one of the cancers that we can prevent. And when we set out putting together Europe's Beating Cancer Plan, for the first time a holistic plan, a well-funded plan, prevention was crucial. Because when we talk about prevention, and we always say it with cancer, prevention is better than cure. But here we have an example where if we can increase the vaccination of girls and boys, we are able to actually eliminate, and Sweden is, I think, a prime example of one of the countries that has implemented vaccination strategies in a way that can actually talk about eliminating one type of cancer that is costing lives, but also affecting so many thousands of women and their families. And it's important for us to move forward with these recommendations for all the EU member states, because although the vaccine is there, it's been there for many decades, it's safe, we have access to it, there are huge inequalities in terms of the number of women and girls and boys that are vaccinated across the EU.
You know, I mentioned this to Akko earlier, and we didn't get a chance to talk about this. I have two sons in their early 20s, and both of them were vaccinated for HPV years ago. And I remember talking through this with their doctor. Why? And he's like, because that's what they're going to do. It's the right thing to do, the smart thing to do. Here in America, you know, fantastic. How can we do that in other countries? I'd love to hear if you could share a little bit more about the plan that was ratified, what your hopes are for that, and mechanisms for implementing it for other countries in the EC.
Our Europe-speaking cancer plan aims to look at the whole cancer pathway, from prevention to early detection to treatment to quality of life after having cancer, and really addressing the inequalities that exist across the EU and improving the lives of cancer patients and their families across the EU for all types of cancer. And that, I feel that we have already moved in a number of joint actions, but there is still a long way to go. And one of the issues, and I'm glad that you brought up, first of all, congratulations on having your sons vaccinated, because it's something that we don't often see, and there is often a resistance against vaccines for girls and more for boys. We see that in the EU. So in terms of cervical cancer, we have now changed the recommendations to ensure that we vaccinate girls and boys and have 90% of girls vaccinated across the EU by 2030. But we need to address also the difficulties that we are seeing in some member states in terms of convincing them to have their girls and boys vaccinated.
And vaccine hesitancy generally. I'd be keen for you to spend a moment on that and how we can combat that. And I'm not, honestly, not trying to make this about me, but since I introduced my sons, I actually have a special needs niece, and there was a point in time here in the States, we're long since past that, but it was several years ago when they were young, where there was a concern about thalidomide and vaccines that might be tainted, and that being a cause of this outbreak. Thankfully, that went away, but there was a lot of discussion in my household about that here in the United States. How are you handling that in the EC?
I'll just say 2 words and then hand over to Akko, because we both saw the difficulties in terms of vaccination and strategies during COVID-19 and with the vaccines. And what we did see, and this we're also seeing sometimes with vaccination for HPV, is the amount of misinformation and disinformation that is out there concerning vaccination. And we have to really address that when we're trying to promote vaccination strategies, not only for cervical cancer, but also for many childhood diseases. And
when we started to offer this cost-free vaccination for girls, 2010, some of them did say no, and that is a problem for us now. Therefore, we have a catch-up vaccination running just now, because they need a catch-up vaccination for those who didn't take it last time, and also for those girls that did take the vaccinations, because the new vaccine that we have today is more effective. So we offer every girl that was born 1994 to 99 a catch-up vaccination today. And when we do that, both prevention, vaccination to all boys and girls in year 5, and then screening, and this catch-up vaccination, then for real, we could shorten the time when we can eliminate the cervical cancer. Because if we don't have this catch-up vaccination, we will reach our goal in 2040, and that's just far away. And now we can do it maybe 2027, soon.
How about counter-information strategies? I wonder if there's any of those that you've employed. That is wonderful to offer catch-up vaccinations, but are there any mechanisms for trying to raise awareness and combat some of this vaccine skepticism?
We are working on that issue right now, because we need to talk to people and build trust. And we have had difficulties during the pandemic, so we need to get this trust back, and you could only get that if you get to talk to people, listen to them. What is your fear? What makes you feel unsafe? Listen to them and give them the answers, because this vaccine is safe.
What lessons have you learned in Sweden and also in the EC that you think can be applied to other countries outside of the region that you think would be helpful to try and strive for this goal of eliminating cervical cancer through screenings and vaccination? I'm sure there were, the success is to be applauded and congratulated. I'm sure there were missteps along the way.
Yeah, I think two things. One of them is equity, because we could offer cost-free vaccination, and that is important. And we use the setting of schools. We reach to every school, girl and boy, and that's important with equity. But also that we have time-bound goals. You dare to set time-bound goals and then design your program after that. You must decide what to do, and we have done that homework.
Make a commitment. How about in the EC, Stella?
I want to pick up just a point that Echo mentioned on terms of vaccine hesitancy, because I think this is really important. One mistake that we often make is when we talk about vaccine hesitancy is we put everybody in one basket. And I totally agree with what Echo says, that we need to listen. We need to understand why people are hesitant. And not everyone is hesitant for the same reason. We need to be ready to give clear, credible information that they are able to trust, and not call everyone someone that is an anti-vaxxer, is just against vaccines. People have valid reasons why they're worried. And we need to be able to listen and to give the right answers, and try to bring people on board with vaccination strategies. These are very common problems across the EU and not only. And what we have been trying to do through Europe's Beating Cancer Plan is really put the goals forward for the EU member states, but going beyond the EU. Dealing with cancer cannot be within your own boundaries. It cannot be dealt with by looking at what is happening within the European Union. And this is why, for the first time, we've partnered Europe's Beating Cancer Plan with the US Moonshot. And we're working across and together to deal with difficult issues like pediatric cancers, like lung cancers, bringing everyone together, because only by doing that, we're going to be able to tackle cancer. And ultimately, that's what we need to do.
Outstanding work. Well, we only have a couple of minutes left. You've both been here at the UN General Assembly, running around like all of us to various meetings. I would love to hear from each of you one thing that you have found hope, and this has been a very positive conversation, by the way. We've talked about some struggles, but one thing that you found hopeful in some of the conversations and discussions that you've had here over the course of the week and some of the meetings that you've been in. Akko, maybe you could lead us off.
It's really important, the decision we will take tomorrow. We will take on a declaration on antimicrobial resistance. We need to work together against this. It's a silent epidemic that we see in the whole world, so we need to work together. And the declaration we will take tomorrow is really good.
Outstanding. Stella?
I will echo that. I will echo that. I will echo that. And although we've been working on this declaration for a while, just being here in New York and having everyone together from across the globe, and really across the globe, working towards antimicrobial resistance and talking about how we all need to work together to deal with this silent pandemic, I think for at least myself, I feel really humbled to be able to be part of this, and energized, as New York is for the last few days, sharing this common goal in terms of global health care.
And walking around everywhere because there's too much traffic and being confident in health.
That's right.
I think our time is up, but I could go on for much longer about the traffic in New York at the moment.
But it's all good. Well, we are very lucky to have you all here to have these positive discussions, and we appreciate your contributions to it. We're actually going to be talking a lot more about AMR a little bit later this afternoon, and I hope you can stick around and hear some of those discussions. Very encouraged to hear some of the work coming out of that. And in fact, we did an AMR simulation with our FP Analytics research team earlier this morning, just in the room down the hall, and I think there were a lot of learnings coming out of that. And when we tackle NCDs next year, I have a feel in my sense, so if I can add my positive vibe, that if we focus and bring everyone together, problem by problem, we'll be able to find some solutions. So I thank you for contributing to that.
Thank you, and thank you also for taking a subject like we were discussing, which is cancer and cervical cancer, and turning it around so that it's come out as positive. I think that's what people need to hear, that we can bring about change.
Wonderful. Akko, Stella, could you give them a round of applause? Thank you so much.
Next.